Hello, hello, hello. Welcome again, everyone, to the first webinar in our series. Tonight, we are going to be talking about pre-pregnancy care and preventative strategies. I see everyone is utilizing the chat. Hello, Sophia. Hello, Annette, Nicole. And we are very excited to have all of our guests here tonight as we share this very, very important information. So, a couple of housekeeping things to discuss first. We have two surveys, a pre-survey, which we're going to get into shortly, and then we have a post-survey. They'll be utilizing the poll for you all to participate, and we encourage everyone on all of our guests to participate, as we will be entering everyone that participates in the survey, in both surveys, into a drawing to win a $75 gift card. So it will be to your benefit to answer our poll questions. It helps us to get more information so that we can further this very important work that we do, and also come up with more topics that would help to address this issue. So today's session is going to be about equipping you with the knowledge and tools to make pre-pregnancy planning more informed and successful. So if you have any questions, we ask you to utilize the Q&A in the webinar, and in the end, we will be addressing questions to our panelists and speaker tonight. And at this time, I would like to introduce the leadership of the Black Maternal Health Project. We have Janelle Lawson, Tony Harp, and Lorraine Gibbons.
Hi, good evening, everyone. My name is Janelle Lawson, and I'm the chair of the Black Maternal Health Project. And to share a little information with you about who the Black Maternal Health Project is, it's actually four nonprofits in the greater New Haven area who decided to join their superpowers together because we all had a platform regarding Black maternal health, and we wanted to move the needle collectively. So the nonprofits consist of the Community Action Agency of New Haven, the New Haven chapter of the Links, the National Coalition of 100 Black Women Metropolitan chapter, as well as New Haven Healthy Start. And our goal is to increase community engagement in regards to Black maternal health. And now Tony will share our mission with you.
Hi, my name is Tony Harp, and I'm president of New Haven, Connecticut, chapter of the Links Incorporated. We are a 52-year-old organization that provides services to Greater New Haven. And we were so excited to become a part of this Black Maternal Health Collaborative. And we love working with other organizations towards one goal. As you can see, the Black Maternal Health Project is dedicated to empowering Black and Brown women to effectively navigate the healthcare system, to eliminate disparities and maternal mortality rates by achieving positive health outcomes through a comprehensive approach that includes advocacy, community engagement, and education. We call that ACE. So we are delighted to be here, and we hope that you enjoy today's webinar.
Hello, everyone. My name is Lorraine Gibbons. I'm the president of the New Haven Metropolitan chapter of the National Coalition of 100 Black Women Incorporated. And I'm here to talk to you about our vision, the vision of our Black Maternal Health Project. So our vision is that we strive to create an equitable healthcare environment where every woman can access the resources and support necessary for a healthy pregnancy and childbirth experience. The Black Maternal Health Project has 3 platforms. The acronym ACE, as you heard Tony mention, it stands for Advocacy, Community Engagement, and Education. That's ACE. And tonight, we launched our 5-part webinar series to provide education and engage the community. And this fits so nicely with the National Coalition of 100 Black Women, our mission, which is to advocate on behalf of Black women and girls to promote leadership development in the areas of health, education, and economic empowerment. And so we are so excited to be a part of this amazing collaborative. And so I will turn this back over to our moderator, Stacey Fields. Stacey, take it away.
Thank you. And a big kudos to the leadership of the Black Maternal Health Project. You all truly have been trailblazers in leading us in this direction. Now, I would like everyone to direct their attention to the screen as I show you who our advisors are. So as you just heard from Janelle Lawson, the chair of the Black Maternal Health Project, Tony Harp, the co-chair, Lorraine Gibbons, the also co-chair, Dr. Cynthia McCraven, our medical advisor, Miriam James, the strategic planning advisor, Sonia Brevard, the health committee chair, Dr. Gretchen Vaughn, our mental health advisor, Natasha Ray, another advisor, Peyton Q. Owens, project manager and marketing advisor, Maritza Bond, public health advisor, Stacey L. Fields, myself, health committee advisor, Kai Perry, project manager and advisor, and Dr. Sharon C. Jones McCann, advisor. Now we are going to get into our first panel discussion. Pre-pregnancy screenings and preventative care are crucial for ensuring a healthy pregnancy and reducing the risk of complications for both mother and baby. Obtaining this care will identify existing health conditions so they can be managed appropriately, and it will dramatically reduce risk. Tonight, we are going to have the pleasure of hearing from 3 dynamic women that are going to highlight how you can prepare for a healthy pregnancy with optimal outcomes. First, we are going to have a panel discussion from Maritza Bond and Dr. Dajna Hart. Maritza Bond, MPH, is a public health leader with over 2 decades of experience in the public sector, serving in both urban and rural settings. Maritza currently serves as the Director of Health for the City of New Haven. In this role, Maritza leads efforts to create a culture of health and wellness with a focus in addressing social determinants of health and health equity. Maritza was named New Havener of the Year in 2020 by the New Haven Independent. She is also a member of the New Haven Links Incorporated. Maritza graduated from Southern Connecticut State University with a Bachelor's of Science degree in Public Health and earned her Master's in Public Health from the University of Connecticut. Dr. Dajna Hart, MS, MBA, FACOG, is a graduate of Spelman College and the University of Chicago School of Medicine. She trained in obstetrics and gynecology at the University of Southern California, after which she joined the faculty at Morehouse School of Medicine, where she was promoted to associate professor. During her tenure in academic medicine, Dr. Hart published articles in reproductive endocrinology and health disparities. Then, heeding a calling to pursue community medicine, Dr. Hart became the clinical lead of obstetrics and gynecology at Southwest Community Health Center, followed by the chief medical officer and clinical lead of women's health at Norwalk Community Health Center, where she currently practices. Dr. Harp has been practicing obstetrics and gynecology for the last 19 years and has a passion for providing patient-centered, compassionate care for all women. She specializes in the management of pregnancy, childbirth care, cervical dysplasia, treatment of abnormal uterine bleeding, fibroids, endometriosis, pelvic pain, and contraception. Uniting her love for clinical medicine and community health, Dr. Harp is dedicated to using her work to address healthcare disparities and advance health equity. She is also a member of the New Haven Links Incorporated. Welcome, ladies, Dr. Harp and Maritza. The first question I have is for Maritza. What are the current trends and statistics regarding maternal and child health, more specifically focusing on infant mortality in rates in Connecticut and New Haven County?
Thank you, Stacey, and thank you for the lovely introduction. It's with great pleasure to be amongst amazing individuals on this panel, and just want to thank all of those who are in attendance today. You know, one of the things that we do in my role is to really do surveillance and monitoring of an array of health issues. And monitoring infant mortality is one of those things. And it's sadly, we see a disparity significantly among Black and Brown women. Specifically, when we look at infant mortality in New Haven, Black babies are 11 deaths per 1,000, and in comparison to 4 per 1,000 of white babies. And we also see a significant racial disparity in birth weight, where we have individual low birth weights of a 1.7 times likely for Black babies than white babies. And in comparison, and this is a report that's public and available from Data Haven, and encourage people to be able to look at that or participate, as they do a lot of surveys every 3 years, which New Haven, the City of New Haven Health Department provides support with. And so when we look at the higher rate of fetal and infant mortality, it's looking at it from a 7.8% versus 4.6%. And we know that we also see late or no prenatal care at 4.6% versus 3.4%, which is also significant. And so when we're looking at that, we know that we need to do more to protect the lives and well-being of infants and mothers.
Thank you for that. That is definitely sobering information to hear of what the disparities are with those rates. Dr. Harp, I'm going to go to you now. Can you tell us what preconception care is?
Sure, Stacey, I'd love to comment on that. But first, I'd just like to thank you also for the lovely introduction, and thank all of the chairs and co-chairs in the vision behind this Black Maternal Health Project, as well as my co-panelists and all of you who have taken the time to come in and listen tonight. It's truly an honor to be here and to talk to you a little bit about preconception care. So preconception care is really what it sounds like, the kind of care that we hope that patients will seek before they decide to get pregnant, before conception happens. And this is really important because it helps for mothers, families to plan for optimal outcomes for their own health, as well as for that of the baby and for their future as a family. I think we can get into some more strategies later, Stacey, but let me know if that's good. I don't want to dominate the floor, but hopefully I sort of set the stage for the importance of preconception care. It's really a time where women who are seeking it can share their health conditions, and we want, especially if they have a history of things like being overweight, having hypertension, diabetes, where we try to work on that so that they can optimize their own health so that they can have a safe and healthy pregnancy.
Yes, thank you. You did a great job explaining that to us, and highlighting the importance of making sure that we get our bodies in the best condition to have the best outcomes before we become pregnant. Maritza, I'm going to come back over to you. Can you explain to us what some obstacles are in accessing care and some solutions for how those can be addressed?
Yeah, no, thank you. Data shows that there are some obstacles that women face in that critical time period, and they vary as different social drivers that are impacting individuals in seeking adequate prenatal care. And some of them has to do with a lack of transportation. We know that, especially in the city of New Haven, there is a challenge with transportation oftentimes. There's also childcare issues and trying to navigate when there is the mom already has another baby, having to go to work and navigate appointments. But one of the things that's really important is also lack of adequate health insurance. In 2021, there was 1 in 16 of childbearing age women, about 6.5%, who were uninsured in Connecticut. And while we've seen it drop significantly, we know that there's also a gap on the quality of health insurance that women have. And we also see language barriers being one of the things that we find as well. And so we know that it does vary significantly by Black and brown women. In New Haven County alone, we know that we had 13.7% higher in inadequate prenatal care among women in comparison to other races and ethnicities. And so it's important that they really get addressed. And ways that people can do that is finding last legislative session, for example, we advocated for the Family Connect pilot that is supposed, that the governor did sign off and was passed as universal home visits as a way that can be able to address some of the concerns and issues that have arisen, and also being able to connect them to federally qualified health centers early on, and also making those weekend appointments available. So really looking at our systems and in ways that we can be able to be there for women when they're in need of not a traditional 9 to 5 doctor's visit. And so that's important, and also referrals and making sure that people get the proper medical or social services that they need so that they can tap into resources that can benefit them, benefit the entire family, and not just looking at the individuals, but looking at the holistic individual and the dynamics that they're experiencing.
Yeah, that is so important that we recognize and highlight that a lot of change starts with policy. So I'm so glad that you brought that out, that a lot of these solutions are in the policies and fighting and advocating for those legislation changes. Dr. Hart, you spoke to us before about what preconception care is. Now, can you tell us who should seek out this care?
Okay, Stacey. Well, in short, everyone who is planning to have a child should seek preconception care. It's really important, even if you don't have any of the conditions that I mentioned previously. I think that everyone can sort of learn, through an exchange with their healthcare provider, whether or not they have other risks that they didn't take under consideration. And also, what are some healthy habits that can help improve your odds of having not only a healthy pregnancy, but a healthy baby. And so some of the things that I just maybe would want to explore with the group, conditions that may not be sort of at top of mind, a history of depression, a history of anxiety, how those may affect your pregnancy, lifestyle factors. Are you a smoker and how that may affect your pregnancy? Have you been using any other recreational substances like marijuana or drinking alcohol? How much is safe or is not safe? Other things too, in terms of your nutritional status, are you getting enough healthy elements and nutrients in your diet? And most of us are not. So at minimum, we would encourage our patients to take at least a multivitamin with folic acid preconceptionally. And so when you are looking at your vitamin bottle, you want to make sure that it has at least 400 micrograms of folic acid, and sometimes more depending on your history, on your medical history. So if you have had children with neural tube defects, then you want to take more. If you have other conditions like diabetes, then you may want to take more, a history of lupus, those sorts of things. So being able to have these discussions with your healthcare provider to guide you so that you can really have the best chances to optimize your health during pregnancy.
Thank you. I love that you brought out mental health as being very important. So this is something that we can take away, that it affects not just our body, but also our mind. Having healthy bodies and minds will help us have a healthy pregnancy. Maritza,
Yes.
what low or no cost preventative services are out there that women can take advantage of, especially our immigrant populations who are often overlooked and may not have access to our healthcare system?
Yeah, thank you for asking that question. I think especially in the times that we are in politically today, there are individuals that just are not going to have access to health insurance or be able to afford it. And so one of the things that we try to promote is ensuring that people know that our health and wellness center is available for screenings and STI testing, as well as education and other resources. We also have a car seat safety when the baby is born. And give out car seats every single year around the year, around throughout the year, so that individuals can have access to that. But also really tapping into our partners, Fairhaven Community Health Center and Cornell Scott, to be able to provide services and also take advantage of, Dr. Hart mentioned nutrition is so important, of the Women and Infants Children program, also known as WIC, which provides food, nutrition, and counseling for individuals that qualify. And, I loved how Dr. Harp had mentioned some examples as well in knowing where there's helplines. I think those individuals that are insured, tapping into the fact that they can potentially get lactation counseling so that they can learn about the importance of breastfeeding, so that they can, if they're not able to get bottled milk, the advantages that breast milk can offer. And then also non-traditional services like doula services that can also be provided. And also, we often talk about the women, but the fathers, right? Like support services for fathers, I think are so critical, because when we have a healthy pregnancy, when we have a healthy home, we also have a healthy family. And so it's important to think about all the individuals in the household. And so I think those are some just examples that I can share at this time.
That was amazing, bringing up the vital role that fathers play in this situation too, of having a healthy pregnancy. Thank you so much for that. Dr. Hart, what are the best strategies that you can give to our guests of having a healthy pregnancy?
Well, I would like to also applaud my sister friend, Maritza Bond, for mentioning all the things that she has, really just talking about using a wide lens from a systems approach to improving healthcare and also looking at support. I think all of us sort of know the genesis of having these discussions, just the weight of racism and some of the other societal isms and how they affect health as a collective and personally, and the importance of self-advocacy and the importance of support. And so Maritza mentioned having doulas. I think that we are looking at trying to see how we implement them more in the clinic arena, in what is known as the ambulatory space, but we also know that they've been very helpful on labor and delivery with labor support. But that's an avenue that we definitely want to continue to pursue and expand, as well as she mentioned, involving the fathers. That's very important. We'd love to see the fathers or the boyfriends, husbands come with the patients to their prenatal visits, coming as a family preconceptionally. We absolutely love that and encourage it. And if the father is not in the picture, having a surrogate, be it a family member or a friend, but that support is so vital. Even though, pregnancy lasts 10 months, there are a lot of different phases that one goes through during that time. And it can be very stressful, even under the best of circumstances. So it's really important to have good support. It's important, as we mentioned, to consider your nutrition, and most of us really don't eat enough fruits and vegetables. So I will put a plug in for that. And to have ways to manage stress, and some of it is with support, but also exercise. And we do encourage exercise even throughout pregnancy, learning about your family history and any genetic conditions which may affect you personally and or the birth of your child. So all of these things are important strategies to have under your belt for a healthy pregnancy. Thank you, Stacey.
Thank you. Thank you so much, Dr. Harp and Maritza, for sharing that very important information with us. I again want to remind our guests, any questions you may have, please post them in the Q&A section, and we will get to questions in the end of our webinar. Now, we would like to move on to the next segment of our webinar. A holistic approach to pregnancy emphasizes the interconnectedness of the mind, body, and spirit in promoting overall health and well-being during our pregnancy. To talk about that, we are going to have Dr. Jennifer Pierre, ND, MPH, who is a leading expert in women's health and a pioneer in integrative medicine. As founder and CEO of Genteel Nature Health, she leverages over 2 decades of experience as a naturopathic physician and public health professional to transform women's lives. With a deep commitment to addressing health disparities, Dr. Pierre specializes in allergies, digestive disorders, and women's reproductive health. Her holistic approach combines the best of natural and conventional medicine to optimize overall well-being. Born to Haitian immigrants, Dr. Pierre brings a unique cultural perspective to her practice, fostering trust and understanding with patients from diverse backgrounds. A sought-after thought leader, she's the co-author of Pathways to Her Rise and host of the WPKN Seeking Wellness podcast, empowering women to prioritize their health. Licensed in Arizona and Connecticut, Dr. Pierre earned her doctorate from Sonoram University of Health Sciences, a master's from the University of Albany, and a bachelor's from Cornell University. She is also a member of the New Haven Links. Dr. Jen? Dr. Jen, we are all waiting with bated breath to hear you, but I think your microphone is on mute.
Thank you. Thank you. I'm trying to navigate doing my own tech for this. So I just wanted to say thank you so much for introducing me, that wonderful introduction. And I also want to shout out my fellow Link sisters for the first segment. I think there's some very interesting topics that we will kind of intersect. So I love that that initial conversation just set the groundwork for what we're going to be talking about. So I am honored to talk about the naturopathic approach to pregnancy preparation. I think this is a topic that a lot of people want to learn more about, like what is it that they can do to help be prepared for pregnancy. So we're just going to jump right in. Okay, so our agenda for this evening is to first start off with the importance of preconception care. And Dr. Dajna already talked about what preconception is. So we have, we're going to be talking more about that. And then we're going to get into some of the challenges, specifically health disparities for Black women, some strategies of what you can do if you're interested in preparing yourself for pregnancy, and lastly, some treatments that are naturopathic and holistic. Just going to read this quote. So when women become pregnant, they feel a responsibility to have a healthy pregnancy. They care about their fetuses more than themselves, which motivated them to look for the best lifestyle. And this quote came from a qualitative study in 2021 where they interviewed women about how they felt motivated to have a healthy pregnancy. And what I thought was really interesting about this study was women feel like when they're pregnant, they just get this sudden motivation to do the best that they can with their bodies. And what I always like to say is, as much as that is commendable, I would love to see more women start thinking about that before they have a child. You know, I always say to people, we only have this one body. And when I was preparing for this presentation, what I really want people to take home is that health starts way before you're planning to conceive. And when you talk to a lot of people, not just women, a lot of times they will blame health issues on age. They may say, oh, it's because I turned 30, 40, 50. But in reality, a lot of our health outcomes have started decades before we start experiencing issues. And why this is important to me. So you heard in my bio, I'm a public health professional and a naturopathic doctor. And I always tell people public health is my first love. So I worked my very first job out of public health. My public health program was a prenatal health educator. So a lot of this is kind of full circle because that was in the mid-2000s at Brooklyn Hospital. And I got to work with the low-income population in Brooklyn, many of them immigrants, and discussing different factors of their healthcare, which, to be honest, I don't see a lot of changes today, which is unfortunate. And as a naturopathic doctor, what I do is I work with a lot of women's reproductive issues. I do a lot of nutritional counseling, and I also address digestive disorders and allergies. And what I believe is basically that an integrative approach to medicine is necessary. And I think starting off in public health and kind of learning the landscape about medicine and then becoming a clinician just really gave me a very good view on just learning how things work in the system. And we can see that an integrative approach is needed. And so that's why I love that there's some excitement to learn more about some naturopathic, holistic strategies. And pregnancy is a miracle. You know, I think a lot of times as we talk about some of these issues and concerns, we kind of forget that this whole process is a miracle. The fact that all of us are here is a miracle, literally. And what I want to see more healthy babies come into the world, particularly Black and brown babies. Like, you know, these statistics are very sobering and they're very sad. And, you know, I want Black women to feel empowered and safe, you know, and feel like they have options and have these conversations with their healthcare providers. So why is this important to you? Pregnancy preparation is preparation for good health across the board. So like I said before, as we're having the conversation and even in the first segment, we heard a little bit about how certain health conditions come into play during pregnancy. But again, if your body isn't in a good state before pregnancy, many times it's going to tax the body even more because you're working on your health for two people now. And even if you're not interested in pregnancy preparation, because not everyone wants to have a child, it's still important to focus in on your health. And I really just want that message to be heard. You know, you could have a family member who you want this information for, and yourself, because the chronic disease rates are going up for everyone, and particularly in the Black community, we're being very, very affected. So I want to see that excitement to make some of these health changes across the board. I love this quote. A successful pregnancy is not just about the moment of birth, but about the thoughtful preparation, mindful nourishment, and unwavering belief in your body's ability to create a miracle. So these are some of the challenges that we're going to be talking about, and I mentioned some of these already. So infertility, it's more recent that we started having very open conversations about infertility. And these are some of our more recent stats. So Black women are almost twice as likely as white women to suffer from infertility. They are also half as likely as white women to seek help for infertility. I think when I first heard about these stats, the first thing that came across my mind was the fact that in our communities, there's this concept of hyperfertility. Like when we look at Black women, when we look at our relatives, we have always, a lot of us have grown up hearing the stereotype about Black women, either Black women being promiscuous, having babies earlier, and it's not necessarily true. But these stats were also beaten into our minds. And I think we also carry this idea of hyperfertility. And we know that Black women are the most educated women and people in our country, which is fantastic. And what comes along with that is delaying having a child. We are moving up the ladder so quickly and doing amazing things. Black girl magic, we hear all the quotes and the accolades. And it's incredible to see like how much we've done, how much we're still doing, and how we're rising in the ranks. But unfortunately, what's happening is a lot of us are delaying child just having a child. And unfortunately, the later in life that you delay that, more problems can occur. It's not always the case. I like to tell a lot of my patients that I am an optimist, so I give them, you know, the real stats, but then also there's a difference depending on how the person takes care of their body too, and what their health risk is in terms of having a healthy pregnancy. And I very much believe that this is an issue of reproductive justice. The fact that there is a lack of access to quality health care, I call it the 3 Rs. So there's a lack of research for a lot of the reproductive health concerns that affect Black women specifically. And in general, women's diseases and conditions that affect women are less studied. Also, there's a lack of resources, and that conversation came up when Maritza was talking about in the public health sphere. You see that sometimes people just have a lack of resources in terms of whether it's traveling, whether it's just good quality food. There's lots of places that people don't have good access. And then lastly, racism. And we've also seen the studies with this. We're seeing Black women that no matter what their socioeconomic status is, they're still at risk. They're still having negative interactions with healthcare providers. And so, unfortunately, sometimes just having more income doesn't necessarily save you. Okay. And then with reproductive health concerns, I kind of mentioned before, we'll have fibroids, which is, you know, very much affects Black women, PCOS, which predispose a woman for diabetes, and endometriosis. So those issues are making creating more issues in terms of infertility. And lastly, access to fertility treatments. So the cost, obviously, it's very expensive to participate in these assisted reproductive technologies. Late utilization for many Black women because of career or other issues going on, personal issues in their lives. And then there's a lack of Black sperm donors. So there's more of a conversation now that many Black women want actual Black sperm, but that there's a deficit in that. So what are some strategies that we can discuss? So I think many people would know, if you look at, you know, I'm trying to get pregnant, you want to discontinue birth control. But what we don't talk about is what is the length of time that would be appropriate. So I generally advise my patients to discontinue birth control at least 6 months. Why do I ask them to do this? Because one, a lot of women will have supplement deficiencies, so nutritional deficiencies as a result of being on birth control. Some of my patients have been on birth control since they were 13, 15, and then now they're 30. And so during that time, you don't really know your cycle. You don't really know if you have any nutritional deficiencies. And a lot of birth control is associated with less than optimal levels of iron, minerals like zinc, and also the B vitamins and vitamin C. So what's really important when I talk to my patients, whether it's fertility or not, is doing blood work that gives you more information. And so when I talk about functional blood work, that's what we're talking about. So we're looking at the nutrients, we're looking at vitamin C, we're looking at vitamin D, and we're also looking at optimal levels. So what do I mean by that? So for instance, with vitamin D, if you look at like any general lab test, the range will say 30 to 100. That's a wide range. So how do you know now as a patient what's really low, what's optimal, what's normal? And so what's optimal for vitamin D is 50 to 70. And so if you're looking at your labs, you won't necessarily know that, but that's what's optimal in general. And so before getting pregnant, you have to address these nutritional deficiencies and also potential hormonal balances. So it's very frustrating when I have a woman come in and she has a condition such as PCOS and she's starting the IVF process. The PCOS was never addressed, and she's moving forward and spending all this money to get IVF and having failed, implantation and things like that. And the reality is there's certain factors that weren't addressed even before starting that. So it's very important to assess that. It's important to assess cardiovascular risk. So looking at inflammation in the body. I like to test sedimentation rate on my patients and also high sensitivity, CRP, C-reactive protein, because it gives me an idea of, do they have any other issues going on? A lot of times people with autoimmune diseases will have high inflammation in the body, and that's going to affect their ability to get pregnant. If a woman has thyroid disease, particularly Hashimoto's, which is an autoimmune condition, that's going to affect her ability to get pregnant. And I like to do some more functional testing. Some of the names are Dutch test and OAT test. And they go further, and the Dutch test specifically, not only does it look at hormones such as estrogen and testosterone, but it also looks at metabolites, which are considered more of like waste, estrogen waste in the body that is created. So sometimes when you do these additional testing, you get more information and you can help guide your patient on what they could do to improve their outcomes for successful pregnancy. Detoxification and gut health. And so when I'm talking about detoxification, I like to be very specific on this. Many times, if you're on Instagram or online, there's all these detox teas and people are saying, oh, it changed my life, all these different things. And I'm specifically talking about the body's natural detoxification process. So our liver's job is to conjugate. And what that means is just basically the food and prescription drugs, a lot of the things that we intake, even the environmental toxins, the liver's job is to grab those things and to kind of clear them out, break them down, move them into the intestines to stool, and then move into the kidneys so that we can eliminate that way through urine. So if that process is hampered in any way, and sometimes when we don't have the right diet and certain nutrients, or if we're exposed to a lot of toxins in our hair products, perfumes, dyes, it just makes it harder for the liver to work. It doesn't mean that the liver's not working. It just means that there's more and more things that the liver has to process and remove out of the body, and that does affect us. So when we're talking about pregnancy specifically, I like to encourage women to move towards organic foods and avoiding conventionally grown. And sometimes when you bring that up, there's this whole debate about are foods really organic? And what I tell people is you cannot go crazy with a lot of these things. These are suggestions, so you do your best. If you can't afford organic, at least just try to eat vegetables, but you just have to try your best. There's a list of the Clean 15. It gives you an idea of what foods are best if you can get them organic. You don't have to get everything organic. But it's just important to know that there's so much in our environment that is toxic that we are consuming. It's causing allergies, rashes, all types of things. For pregnant women, you want to keep your intake of mercury low. No sushi is generally recommended. And then you want to keep your omega-3s high. So an example is wild-caught Alaskan salmon, not Atlantic, for instance. Wild-caught is a better variety. And what really affects our community is a lot of the things we're putting on our body, these hair products that have parabens, and parabens are just preservatives that we're reacting to. And it can cause rashes and itching and things like that. Deodorant is a big one. Using aluminum deodorant is also not beneficial. So I would never advise a pregnant woman to use aluminum deodorant. And so you can see there's a bunch of different things here we have to consider. In the home, there could be mold in the home, especially in certain communities. If there are You know, any kind of leaks in the home, black mold can develop, and that's not good for our health. Using stainless steel pots, our cleaning solutions, avoiding bleach, all these things are affecting us. And they can also form as xenoestrogens, which are just basically saying outside estrogens in the body that can be hormone disruptors. So it's important that, one, do not cleanse while you're pregnant, but that 6-month period that I talked about gives you that time period to kind of clean up your environment, make sure your bowels are moving properly. We should have at least one bowel movement a day. And then following an anti-inflammatory diet. So that means foods that are not causing inflammation to the body. We kind of talked about it a little bit with Dajna. Dr. Dajna talked about, you know, eating healthy foods. So cruciferous vegetables like broccoli and kale and cauliflower. And I know this brings up a lot of issues in our communities because sometimes people say that, oh, these foods aren't tasty. And I always say to people, it's about how you season them. I think our cultures know how to season food very well. So you can do the same thing with vegetables. And then it creates more of an environment where you're actually enjoying your food. Diet and nutritional supplementation. We talked a little bit about prenatal vitamins and folic acid. And it's important to know that a lot of the vitamins, they are not created equal. This is one of the main things that I talk to my patients about. Sometimes people are buying vitamins from CVS, Walgreens. I don't recommend that. I recommend, I have my own dispensary of physician grade supplements, pharmaceutical grade supplements that are better quality. They have ingredients that are bioavailable. And what that means is that they're closer to the natural foods that we would consume, so the body readily accepts it, as opposed to the synthetic form of these vitamins that we don't process as well, and then can also have issues. And then they have a lot of fillers. So if you look at vitamins, you'll see things like red number 40 and we shouldn't have any colors added to our vitamins. We shouldn't have all these different fillers to our vitamins. If there's like 8 different ingredients in the other ingredients panel, then most likely it's not a good quality vitamin. So I love having this conversation with patients and just teaching them what is considered a quality vitamin. For instance, with prenatal vitamins, every time people talk about iron, they tend to mention that it's constipating, but there's certain forms of iron like iron bisglycinate that is not constipating. So it's important to just know those distinctions so you don't totally avoid taking certain vitamins. And then in terms of fertility supplements, I think there used to be a lot of backlash towards this, but now even a lot of reproductive endocrinologists have acknowledged that a lot of this supplementation can help with egg quality. In my world, I use a lot of these supplements with patients to great results. So for instance, DHEA is a hormone that is a precursor, meaning it comes before estrogen in the hormonal pathway. And if a woman has low DHEA or DHEA sulfate, which is a form of DHEA, they can have issues with pregnancy. So sometimes I'll just supplement with that. And then CoQ10 has many studies about CoQ10 with egg quality. And then, of course, the Chinese herbs and Western herbs, because I've also been trained in Chinese medicine and acupuncture. So there are herbs that are very harmonizing and help with irregular menses, heavy menses, and those types of things. In terms of exercise and diet that we kind of talked about, with exercise, start slow. So during pregnancy and trying to get pregnant is not the time for you to start doing marathons or doing aggressive exercise. Of course, obesity can cause issues with getting pregnant, but you can just start very simply with walking. In terms of healthy diet, it's important to have protein. I like to tell people that starting off with 25 grams of protein per meal is a great way to start. You have to adjust for your weight, but that's a great way to start. And every meal, just think about, where's my protein? Where's my protein in this meal? Where's my fiber? Fiber, again, helps with that detoxification process. If we're not consuming enough fiber, And the estimate right now that we like to tell patients is 35 grams of fiber. If people can't get to that point, just do your best. And you're getting a lot of that fiber in beans and a lot of the cruciferous vegetables, the leafy greens. And foods, there are also foods that can help increase progesterone, which is important in the earlier stages of pregnancy. We're very familiar with the idea that we shouldn't drink alcohol, but we don't talk as much about caffeine. There's more of a conversation about that, but just avoiding things like Red Bull and things like that, it's just not beneficial in terms of pregnancy. So I talked a little bit about exercise. I mentioned walking and how that could be beneficial. It's low impact on the joints and on the body. Yoga and Pilates are great because it opens up the hips, which is a very important area during pregnancy. It also helps with stress reduction. It helps lower cortisol when you're doing exercises that are, relaxing you. And then breathing exercises. One of my roles after in between the public health and naturopathic medicine was I became a yoga instructor. And so it's not uncommon that before I do a presentation or even when I'm talking with a patient, I may talk about breathing exercises. It was very beneficial for me. It's still beneficial for me in terms of stress reduction and my mental health. So I'm always recommending that people just try breathing exercises, yoga and Pilates. It can be really beneficial to the body. And what are some holistic treatments that we can talk about? So as I mentioned before, I do acupuncture on my patients. I was a fan of acupuncture before I even learned how to perform it. I used to get migraine headaches in my early 20s, and that's when I was first introduced to acupuncture. But acupuncture has been studied very often now. There's lots of research on it, and it shows that it's helpful for embryo implantation with IVF. It increases blood flow to reproductive organs, which helps improve sperm count and motility, helps to regulate the menstrual cycle and fertility hormones, and it also helps with sleep, stress, and anxiety. So the majority of the patients I see with acupuncture, it's stress and anxiety. It helps to relax you. And if you're not as familiar with acupuncture, it's thousands of years old. Most people are afraid of acupuncture because they hear needles and they're automatically turned off. But the needles are very tiny. They're like the size of a hair strand. And when you put these needles in certain areas, in the body, the Chinese look at the body as having meridians, which are little like highways throughout the body. And if there are blockages, which usually manifest in pain in the body, and particularly with women, this uterine area tends to be what we call in Chinese medicine congested. So it's kind of blocked up. There could be scarring. There could be other things going on. And so acupuncture helps to kind of release those blockages. It helps a lot with pain. And I've seen it be very beneficial with my patients in terms of fertility. These are some more natural therapeutics and tools. Mayan uterine massage comes from South America, and it helps with scar tissue and trauma to the uterus. Fertility monitoring we're familiar with, but a lot of the hormone monitoring kits don't necessarily include the metabolites that I talked about before. So some of the more holistic friendly kits, one company that comes to mind is UVA. They take a look at estrogen, LH, FSH, and some of the metabolites so that the ovulation, you can get a better assessment of ovulation, especially with someone who may have issues like PCOS where she has irregular periods. And then in terms of fertility lubricants, again, something that is known in the conventional space as well. But a lot of the fertility lubricants have ingredients in there that are not beneficial to women and can cause allergies and rashes. And so we want to create an environment that's hospitable to sperm, but we don't want to also have side effects of using a fertility lubricant that is going to cause rashes and things like that and discomfort. And kind of the old school one is checking basal body temperature and cervical mucus. I usually advise my patients to do this along with the hormone monitoring kit, but it's an oldie but goodie. If you monitor your temperature, you can get an idea of those changes to kind of track ovulation. And also I'll teach my patients how to notice the changes in cervical mucus. So it can change from dry to stringy to sticky, and that can help you assess where you are in your cycle. And in conclusion, don't wait until pregnancy to create a healthy environment. We want to start thinking about that regardless, whether we're in our, prenatal period of life, whether we're postpartum, whether we are, whether we are not even thinking about that and are just in the golden years of our lives, I'd like to say. Just know that it's important to just still pay attention to our health, because even when we are postmenopausal, we still have to think about hormonal balance and working out and keeping our bones strong. And the fact that estrogen is decreasing at that point of our lives makes us more at risk for cardiovascular issues. And finally, good health equals good life. And these are some of the references that I discussed. And this is how to contact me. And I do want to mention that for people on the call, what I decided to do is do a half off on a supplement review if anyone's interested. It's something that comes up a lot with me. Once I start mentioning that there are certain things you should know, people automatically say, well, how will I know? How will I know? So if you contact the office, we'll provide a 50% off on a supplement review. And that's all I have for tonight. Thank you so much for paying attention and listening and just being here. It's just wonderful that we have such a great turnout.
Thank you so much, Dr. Pierre. We greatly appreciate the information that you brought out to us. That was so much useful information. So again, we thank you. Thank you so much for sharing. And I hope all of I hope all of our guests take advantage of that half off offer. So what we're going to do now is bring up one of those polls that we discussed about in the beginning. So please, everyone, it will go very quickly. Please answer these poll questions. Again, we are entering everyone who participates in the poll into the drawing $75 gift card. And again, this information helps us so that we can prepare the content that is needed for our target audience so that we can address this problem. So tonight, I think the poll has closed. Tonight, we talked about the importance of getting your screenings pre-pregnancy, your healthy lifestyle, involving your partners in the pre-pregnancy journey. And Dr. Jennifer, I loved your 3 R's: research, resources, and racism. So powerful. And we also want to share with you, again, this was the first of our 5-part webinar series. Our next webinar is going to be on December the 11th, again at 7:30, and we're going to be talking about pre-screening and managing chronic conditions. We will have another webinar on the importance of mental health. We'll talk about prenatal and infant mortality and prevention and best practices. And then we're going to close out our webinar series with conversations and Q&As with providers. So this will be your opportunity to get your questions out to the obstetrics and gynecology providers so that you can really get as much information as possible for your pregnancy journey. And then all of this will culminate into our second annual Black Maternal Health Summit, which will be held on April the 12th in 2025 at Southern Connecticut State University. And I mean, if you attended last year and all of this eye-opening information that was brought out, you will definitely not want to miss next year's summit, which will bring out even more information and what we can do, a call to action, so that we can stop this problem of Black women dying at alarming rates during and after childbirth. So we have one more poll question that we want to put up, and this helps us again, some demographic information that tells us more about our audience and how we can be more impactful in our messaging. So I'll give you a couple of minutes for that. Again, answer these poll questions so that you can be entered into the drawing to win a $75 gift card. We will draw the winner and we will contact you after the webinar. So again, we thank you all so much for coming this evening and listening to the presentations. We thank Dr. Harp, we thank Maritza, and we also thank Dr. Pierre and the leadership team of the Black Maternal Health Project, Lorraine Gibbons, Janelle Lawson, and Tony Harp, for leading and guiding us in addressing and attacking this problem. And everyone can, if you can focus your attention to the QR code that is on your screen now, if you follow that, it's going to take you to a link so that you can register for our future webinars, purchase tickets to the Black Maternal Health Summit, which we have an early bird special going on until January the 30th, that you get a discount if you buy your ticket before that date. It'll also take you to links to our social media platforms, and you can sign up to be on our mailing list to find out all of the important things we have going on. And there is also a link to donate to this very, very important work that we are doing, and help us further this work. So I would like to end now, again, by thanking everyone for being here and all of our participants, all of our presenters, and let you go on about your evening with this inspirational quote. Preparing for a healthy pregnancy is the first step towards a healthy family. So again, I thank you all and have a good night.